Hi, hey guys, Tim Janik here. I'm going to be teaching the Posturology 101 here in Houston, Texas. That's a Neurosomatic Educators program for evaluating posture. A very, very thorough program that, you go over tons of landmarks, bony landmarks to decide whether if you see where you can see postural distortions. So that's going to be taught here in Houston, February 20th through the 22nd. It starts Friday night from 6:30, goes to 9:30, and then Saturday, Sunday from 8 to 5. So if you're interested in that, you can go to the link below this video, neurosomaticeducators.com. Go on there and you can actually sign up for the course online for here in Houston. Okay, so one of the things I wanted to talk about, just one of the distortions, there's a lot of discrepancy on where distortions start. If they start at the feet, or if they start at the head, or if they start in the hips. Okay, and the truth is they could really start anywhere. Okay, you could have a head injury, whiplash, things like that, and then all of a sudden we start getting a chain reaction down. Or you could have an impact in the hip, and then things start going up and down. Or maybe sprain your ankle. Okay, and one of the things that I wanted to talk about is if you look over here to the right of the chart, you'll see four questions that we answered from doing a postural assessment. Okay, one of them is if there's a leg length inequality. The second one is, are there fixations, muscular fixations? So usually we'll do a measurement. We'll do the measurement from in standing position and also in sitting position, also in supine position. Okay, so we'll be able to tell if they have a muscular fixation, if the muscles are holding their postural distortions, by looking at them standing and also supine. Okay, SPM, subtle proprioceptive mechanisms. Okay, that means that if their postural measurements change from standing, they're going to supine. Okay, that could be related to the organs, meaning that their organs need to be worked and massaged. Okay, the last one is following the demands of the writing reflex. Okay, if their cranium is correlating with their hips, and later we'll actually do a video on that. Okay, how to kind of determine that. So what I wanted to do real quick is just go over leg length inequality. This is actually one of the very first things that we look at whenever we're looking at people. All neurosomatic therapists check for this and to see if there is something like that going on. So if you look over here, you can see I've drawn some lines here. And when we look at leg length inequality, we're looking at anything from the greater trochanter down. We do two measurements here, one at the greater trochanter, looking at the superior aspect of the greater trochanter, and then the second one is at the superior aspect of the tibial tuberosity. Okay, and what we're seeing here is that it's low or inferior on the left side, superior on the right. And we go down to the tibial tuberosity, you see the same thing as what we're seeing in the greater trochanters. So superior on the right, inferior on the left. Okay, and then the floor is level. All neurosomatic therapists will measure the floor, make sure that the floor is level before they start doing postural assessments, because if the floor is off, it's going to throw the rest of your measurements off. All right, so if we look at this, what we're looking for are parallel lines. And we can see parallel line from the greater trochanter to the tibial tuberosity. Those two lines are parallel. Okay, so that would mean that both femurs here are basically the same length. Okay, after that we go down to the tibial tuberosity, and what we can see here is that these two lines are not parallel to each other. That's why having that floor level is extremely important when you're doing a postural assessment. Okay. So when we look at this, we can see that the left side is inferior, the right side is superior, and so that's indicating that possibly that left tibia is shorter than the right tibia. Okay. Then what we'll do is we'll take that and we'll go over here and we'll compare it to our supine measurements, and our supine measurements could look something like this. When they lay down, their hips are balanced. Okay. And then what we end up seeing is here at the the tibial tuberosities, okay, are balanced. But then what we also see after that is the left heel pad being superior and the right one being inferior. If we take the same process that we did here, we look for parallel lines, we can see that again the femurs are both the same length because the greater trochanter is parallel to the tibial tuberosity. Then we move down to the last one and we don't see parallel lines. We actually see a superior left heel pad and an inferior right heel pad. Okay, so that would again indicate that that left tibia here is the shorter side. So taking both the supine measurements and the standing measurements, we can almost come to a conclusion of where the short leg is happening, what bone is short. And then after we've done that, what we'll do is we'll send the client to go get an x-ray in a standing position like this on a template in order to confirm what our measurements are, okay? So that's one of the things that we're looking for when we do posturology. That's actually the very first step towards helping somebody with the low back pain, neck pain, shoulder pain, migraine headaches, any of those things, because if the base isn't solid, if the base isn't structurally sound, then everything else up above it is going to be off, okay? So that's very important to make sure that we rule out the possibility of a leg length inequality. All right, so if you have any questions, feel free to post comments below. You can also go to the website and sign up for the course. All right, thanks and have a great day.